This is the video on the side of the neck. We are going to do the anatomy of the neck in this video. This video is going to be super helpful for you. Trust me on this. What do you need to know about the side of the neck first? You need to know that the side of the neck is rectangular in shape. You can also keep your atlas with you right now, so it is going to help you a lot. Uh, Most of the people use Netter as atlas, so you can open the page where there's the photo of the side of the neck, or whichever book you use, just open a diagram there. So the side of the neck is rectangular in shape. The boundaries of this rectangle are: superiorly, it is bounded by the inferior border of the mandible till the imaginary line from the angle of the mandible to the mastoid process. Anteriorly, it is bounded by the imaginary line from the symphysis mentae and suprasternal notch. Inferiorly, it is bounded by the clavicle, and posteriorly, it is bounded by the anterior border of trapezius. What other thing you need to know about this rectangle is that this rectangle is divided into two triangles by the muscle sternocleidomastoid. The two triangles that the sternocleidomastoid muscle is dividing them into are the anterior triangle and the posterior triangle. So the posterior triangle, the boundaries are: anteriorly you have the posterior border of the sternocleidomastoid muscle. Then inferiorly you have the clavicle, and posteriorly you have the anterior border of trapezius. You also need to know the contents of this posterior triangle. So the contents are accessory nerve, then the greater auricular nerve, the transverse nerve, the transverse cervical nerve. This is the transverse cervical nerve that I'm talking about. And then you have the lesser occipital nerve, supraclavicular nerve, and the external jugular vein and subclavian vein. I hope that you are writing it down while I'm speaking it, so it's going to help a lot. So you need to know that the accessory nerve is obviously the 11th nerve, and you also need to know that the great auricular nerve is the branch of cervical plexus. The transverse cervical nerve is also the branch of cervical plexus. The lesser occipital nerve and the supraclavicular nerve. So these four nerves, the greater auricular, transverse, cervicals, lesser occipital, and supraclavicular, these are the cutaneous nerves. So you can make a mnemonic for it, like LGTS or something like that. So then there are the two veins that we can talk about: the external jugular vein and the subclavian vein. So yeah, moving forward to the contents. These are the contents that I talked about earlier. So this is wrong right here. The accessory nerve is not included in these. So yeah, moving forward to the anterior triangle. The anterior triangle is further divided into four triangles, but first we're going to do the boundaries. The anteriorly, it has an imaginary line from the symphysis mentae to the suprasternal notch. Superiorly, we have the inferior border of mandible and line extending from the angle of the mandible to the mastoid process. Posteriorly, we have the anterior border of the sternocleidomastoid muscle. When you will be doing it in the further slides, I'll show you how you'll learn it very easily with the diagram, and it will help you a lot. But keep your atlas closed right now, because it's obviously confusing if you're doing it for the first time. But I hope all of you are doing it for review purpose. This is going to help you have an overview, a proper overview, so that it's very helpful for your exams and revision stuff. Moving forward, the anterior triangle is further divided into four triangles. So we have the digastric triangle. Digastric triangle is also known as the submandibular triangle. So you know that triangle is going to be below below the mandible. Then you have the submental triangle. The submental triangle is obviously going to be below the mental area. Then you have the carotid triangle and the muscular triangle. So this is the rectangle that we were talking about, that the neck is. And this is the sternocleidomastoid muscle, which is dividing the anterior triangle and the posterior triangle. this we drew a you know a V shape. So this V shape is basically the anterior belly of digastric muscle. You'll see it further, so you don't need to get tense about it. Just make the triangle, make this whole thing while I'm making it. So this is the V shape, and now we have turned this V into a Y. So this was this right here, this line of the V was the anterior belly of digastric muscle. This is the posterior belly of the digastric muscle. This is the superior belly of the omohyoid muscle. But don't get confused. You'll get the labeling right after it. So here this is another line which is cutting through this part. So we can so this is the hyoid bone. This is the location of the hyoid bone. It's not cutting there, but just so for the concept right now, for the drawing purpose only. So this is here. Now this is the anterior triangle, the posterior triangle, the labelings, as I said. This is the anterior belly of digastric muscle, the posterior belly of the digastric muscle, the hyoid bone, the superior belly of omohyoid muscle, and this black line is the sternocleidomastoid muscle. Now further, you already knew that the posterior triangle is bounded anteriorly by the posterior border of the sternocleidomastoid muscle. So this you see here is the posterior border of the sternocleidomastoid muscle. And inferiorly, this right here is the clavicle. And this line over here is the anterior border of the trapezius muscle. So this is how you know that this is the posterior triangle. Now let's talk about the anterior triangles, and further let's talk about different triangles in this part. So the first one is the digastric triangle, which is the submandibular triangle. The submandibular triangle. So the submandibular triangle is basically anteriorly it has the anterior belly of digastric muscle. Posteriorly it has the posterior belly of digastric muscle, and superiorly it has the inferior border of mandible and the imaginary line extending from the angle of the mandible to the mastoid process. The contents of the submandibular triangle, just write them down. These are submandibular gland, facial artery, hypoglossal nerve, facial vein, submandibular lymph nodes, and a part of the parotid gland. Now let's talk about the submental triangle. The boundaries of the submental triangle, this is the submental triangle right here. The boundaries of the submental triangle are the imaginary line extending from the symphysis mentae. So this is as we knew that this was the inferior border of the mandible, and this is the anterior-most region. So anterior-most, there's the symphysis mentae at this point. So there's an imaginary line from the symphysis mentae to the hyoid bone till here. This is the hyoid bone. So hyoid bone, symphysis mentae, this is the imaginary line. Then laterally you have the anterior belly of digastric muscle, and inferiorly you have the hyoid bone itself. The contents of submental triangle are the submental lymph nodes and anterior jugular vein. Now let's talk about the muscular triangle. So this is the muscular triangle. The muscular triangle is anteriorly, it is bounded by an imaginary line from the hyoid bone to the suprasternal notch. This, this whole line is the clavicle, and here is a suprasternal notch. So from here till here, this is the anterior border. So the imaginary line from the hyoid bone to the suprasternal notch. Then superiorly, you have the superior belly of omohyoid muscle. And inferiorly, you have the anterior border of sternocleidomastoid muscle. The contents of this muscular triangle are the infrahyoid muscles. Now let's talk about the carotid triangle. In carotid triangle, you have the boundaries first. So the boundaries are superiorly there is the posterior belly of the digastric muscle. Inferiorly you have the omohyoid muscle, and laterally you have the anterior border of sternocleidomastoid muscle. The contents are, firstly there's the carotid sheath, and the contents of the carotid sheath, which the contents are the common carotid artery and its branches, internal jugular vein, vagus nerve, and ansa cervicalis. And also there is a the carotid the carotid triangle also has the deep cervical lymph nodes. This right here is a mistake. This is carotid triangle, not carotid muscle. This is a carotid triangle. So let's talk about the blood supply of the neck. The neck is supplied by the common carotid artery. There are two common carotid arteries, the right and the left common carotid arteries. The right common carotid artery is a branch of brachiocephalic trunk, whereas the left common carotid artery is a branch of arch of aorta, hence longer in length. These common carotid arteries will divide into internal and external carotid arteries at the superior border of thyroid cartilage. The superior border of the thyroid cartilage is present at the level of the junction between C3 and C4. I hope you already know that. At the bifurcation of common carotid artery, there are two sensory receptors. One for the pressure, the baroreceptors, also called the carotid sinus, while the other is the chemoreceptors, which are the carotid bodies, also called the carotid bodies. This was just an extra information. Now let's talk about the external carotid artery. It is a external carotid artery is basically a terminal branch of a common carotid artery. The origin of this branch is from the common carotid artery at the level of superior border of thyroid cartilage. The branches of the external carotid artery are the occipital artery and the posterior auricular artery. So these two are the posterior branches. Superficial temporal artery and the maxillary artery are the terminal branches. So the facial artery and the lingual artery are the anterior branches, and you have the ascending pharyngeal artery, which is the medial branch, and superior thyroid artery anteriorly. Moving forward to the internal carotid artery. You need to know the origin, obviously. So it arises from the superior border of the thyroid cartilage. What are the parts of internal carotid artery? We know that there is a cervical part. There are four parts of the internal carotid artery. There is cervical part, which has no branches. There is also a carotid canal in petrous part of the temporal bone. So that is the petrous part. So the first is cervical, then the petrous part. Yeah. So it has two branches. The cavernous part is present within the cavernous sinus, and this cavernous part gives off branches of cavernous part gives off branches to the pituitary gland, the superior and inferior hypophyseal arteries. I'll repeat this one. The cavernous part has branches which will give branches to the pituitary gland, the superior and inferior hypophyseal arteries. You'll study that when you'll be studying pituitary gland. Then there is a cerebral part, which is between the cavernous sinus and cerebrum, and it has 5 branches. This cerebral part has 5 branches. It was a common Viva question as well, as I remember. So there was the 5 branches are ophthalmic artery, anterior cerebral artery, middle cerebral artery, posterior communicating artery, and the anterior choroidal artery. I repeat, ophthalmic artery, anterior cerebral artery, middle superior artery, posterior communicating artery, and anterior choroidal artery. So this was it for the neck. So I hope you understood the concept, the side of the neck, and you understood whatever there was. If there are any problems in the slides, please feel free to tell me in the comments below. And I hope you liked the video, and I hope that this was helpful. Thank you very much.